To my patients. We are now effectively in the 8th month of the year. Time has passed fast despite travel restrictions, ruined vacation plans, family separations, quarantines. New rules implemented in our lives, initially so outrageous, now are forming the new normal without questions asked. Wearing masks or social distancing seems to be a small price to be paid in order to see friends, family, grandchildren. Relentless hand sanitizing has become a routine way of life. And this is all happening in the last 6 months. At times seems like a lifetime. Our work routine, communication routine, travel routine, entertainment routine, all has changed and has definitely influenced our physical and mental health. New concerns involving all aspects of our lives, including sustaining life itself, have emerged and taken, unfortunately, a stable place in our thoughts. All these factors have released ACE2 of symptoms associated with stressful times, lack of energy, loss of focus, stress eating, insomnia, lack of interest, etc. Not to mention the struggle through the recovery for those who actually contracted and now are recovering from COVID-19. Without fear sounding repetitive, and with few additions to my previous recommendations, here are the talking points. Number 1, please get your flu vaccinations early this year, all age groups, but of course, especially age 65 plus. Number 2, although time flies, don't forget annual evaluations. Our office is equipped to service you safely, providing appointments at time slots without exposure to other patients for blood tests, EKGs, COVID tests, and ultrasound services. Follow-up services are provided via telemedicine or in person, depending on your preferences. Number 3, office hours are 9 a.m. to 5 p.m., Monday to Friday. Answering service is standing by after hours with Dr. Levin on call for any emergencies. Number 4, social distancing, face masks, frequent hand washing, and sanitizing are still in vogue more than ever. These have proven the most effective prevention measures, especially since we don't have any other measures to offer at this time. And number 5, reminding you that COVID-19 virus is colorblind, all-inclusive, and equally destructive. It takes a pathogen to erase all the boundaries. I wish rather mankind would. Number 6, testing. Testing is a safety measure, also information for early treatment and contact tracking or tracing. That leads to effective quarantine and decreased infection spreading. Number 7, to patients who have recovered from COVID-19 infection, please consider plasma donations. Your donation can be the determining factor for convalescence, for saved lives. For information, go to oneblood.org. Number 8, election season is in full swing. Please request your mail-in ballots, absentee ballots, register to vote. Take advantage of early voting opportunities in your area if you prefer to cast your vote in person. Make your voices heard regardless of the color of your choice. The scariest color is gray, the gray of indifference. Sleeping minds create monsters. Number 9. Politically substantiated treatments have never been successful in controlling your blood pressure, diabetes, congestive heart failure, etc. Neither is COVID-19 subject of political correctness. Testing is most important. Preschool, returning to work, visiting elderly relatives before and after travel. Either you are employee or employed. Test. And to all the mothers turned educators, teachers, fathers turned into home gym creators, to the sad and isolated grandparents, carrying the worries for their children and grandchildren in their hearts, unable to protect them only with distance, to the frontliners, secondliners, and all base fillers, my deepest respect, a biggest hug postponed indefinitely, and the promise of a omnipresent support. Sincerely, Dr. Esther Levin.